So let's just start with the goals of healthcare reform. So why are we doing all this? What's driving all of this? Well, when we first established Medicare and Medicaid in 1965 under President Johnson, it was a very different day. Now, the life expectancy, if we looked at all demographics, all genders, and we put everybody in the same bucket, was 68.2 years of age. So when they enacted Medicare specifically, with the average life expectancy, we were only taking care of the U.S. population. They weren't that old, and we were only having to carry water on caring for them as a taxpayer community for about 3.2 years. Additionally, the cost of care as a percent of the gross domestic product. Now, what this represents is if I spend $1 in the U.S. today, how much of that dollar goes to food or transportation or housing, or in this case, health care? And in 1965, 5.8 cents of every dollar spent in the U.S. was spent on something healthcare related. But that's changed. As we've moved forward, we keep people alive a lot longer. We've expanded that over 10 years. As a result, we have an aging demographic, an aging population. You compound that with a lot of other factors, and right now our cost of healthcare is outpacing the rising cost of, or inflation. It's outpacing inflation, which makes it almost exponential. And it is over 17%. So we're closing in on a fifth of our economy being related to health care as a percent of our gross domestic product. We also have some factors specifically compounding that they're trying to remedy in health care reform. One is just about everybody who is of this older population age has at least one chronic disease, if not up to 5 or more chronic diseases. So we've got some pretty sick folks out there. We've also got the baby boomers that are coming onto the Medicare dime. They started to enroll last year. You had 2.8 million boomers enroll into Medicare, and that trend will continue for the next 20 years at a rate of 4.2 million per year. So essentially you're going to double that population on the Medicare program. If we do not change the way that we deliver care and the way that we pay for care in the U.S., the way it's going right now, this is where we will be by 2035. 31 cents of every dollar spent in the U.S. will be spent on something healthcare related, and that is absolutely insane. It's something that we cannot sustain, and that is what's driving healthcare reform. And healthcare reform, as we've been trying to do this, you can take it all the way back to Bill Clinton. If any of you have been in the healthcare industry, you may remember the days of HMOs. I mean, there's been a lot of runs at trying to reform this. So this is not a new problem that they're trying to solve.